when should a parent start getting concerned, and when should a parent start actually seeking intervention?
Listen, any child psych evaluation, any pediatric evaluation, any neurologic evaluation, sleep habits are going to be the foundation of that discussion, right? It's crucial, especially in a psychiatric evaluation. And, I want everyone to understand that our brain is forming through the age of 25, right? And we know that sleep is restorative. There's been plenty of neurologic data, hard neurologic data, that shows that sleep is a restorative thing. And it's very, very important. And if we're not getting sleep, there's going to be mood dysregulation of some kind. And if you're not getting sleep, again, it's adding fuel to the fire. So if parents are noticing that their children are having a difficult time falling asleep, staying asleep, maybe sleepwalking, sleep talking, maybe there's some breathing issues, some snoring, I think it's always a great idea to have your child evaluated by the pediatrician initially, just to get the ball rolling. So if you notice anything out of the ordinary, go see your pediatrician first.
Great idea. Also, you talk about parents who really kind of are at wit's end of trying to help their kids. The kids are tired, they're crying because they can't fall asleep. What about medicating your child? When do you do it? How much is appropriate? What's the strategy for parents on that?
First of all, we're talking an age range of 0 to 18, right? So depending on the age and development of that child is really going to dictate whether or not we're going to even consider medications, let alone, remember that list of potential issues that might be causing the sleep disturbance? We have to get a diagnosis before we could even think about the medication that we might use, right? So first and foremost, right, depending on age, depending on development, depending on the diagnosis, we're always going to consider sleep hygiene first. That is always going to be the foundation of this. And sleep hygiene, right? We need to make sure that, that they're not overstimulated before bed, that they're in a comfortable environment, that they're limiting electronics in bed, get the TVs out of the room, right? All of these things have to be done first, and then maybe we'll consider, again, depending on age and development, maybe we introduce a little melatonin. Maybe we introduce a little bit of like an antihistamine, right? Mm-hmm. But here's the important point, is that medications for sleep aid, and you know this, doc, right? As a doc, we want these to be short-term and only to reinforce a good circadian rhythm, right? We just use sleep medicines to get people back on track. You never want to use sleep medicine as an end-all, be-all, because it's very easy for children and adults to sort of become reliant on a prescription medication. So it's best to avoid shortcuts to meds. Diagnosis is key. Development and child age is important. But even if you go to a medication, it's something that's going to be short-term.
Dr. Sportelli, as always, great information. Thanks for helping to clarify such a really important topic.
Always great to be here.
Okay, for more information on children and sleep strategies, just go to thedoctorstv.com.